what do you think about, so a big thing we're kind of getting into, like fitness isn't just like the physicality. And I think this like incorporates with like backpacking too. So like, what does it mean to be fit to you, or what is fitness to you?
But dude, so like, man, I didn't have a lot of money growing up. So what was the hobby that I could do? You know, it was like $20 a month to go to the gym, which I had to pay for. But I paid for that, and I mean I get to hang out at the gym for 2-3 hours after school every day. That's easy, you know. That's a good purchase. And I mean, I've been active ever since I've been like born. So literally, it was my life, and I was an engineering. I was in an engineering program in high school. Super boring. I love exercise. So, you know, like I'm a physical therapist, and literally like I use exercise as medicine now. So that, you know, people don't have to do prescription drugs, do surgeries, things like that. You try to do exercise first, because really, I mean, what does America need? I think America needs exercise more than almost anything. You know, we're so sedentary, and it's just part of my life. You know how people eat breakfast or lunch. I go to the gym. It's just another.
Yeah.
It's like breathing. Of course, I'm gonna go to the gym. It's nothing for me now.
Yeah.
It's everything.
Just because you're totally right. Like that's truly what America needs. It's a huge problem that does not get enough media, does not get it talked about nearly enough. And then we're also seeing like a big increase of mental illness, right? Of people with depression, anxiety, and the same thing could apply. Just getting into fitness and eating healthier would totally help that.
Oh yeah, like
yeah, literally fat deposits. What, Braden?
You can go ahead. The fat.
Oh, dude, yeah, fat cells store hormones, right? So if you have a ton of fat, like on your body, a ton of adipose tissue, you're going to be storing like androgen, like a ton of hormones, and then all those hormones are obviously going to mess with your neurotransmitters in your brain, and like that's why there's like depression, you know, and there's like people with anxiety and stuff. And what does, you know, exercise do? It produces endocannabinoids, dopamine. There's so many reasons why exercise is the answer, and it's not utilized enough. Literally, they're using medicine to simulate exercise. You know, like that's what they're doing, and you can't do that. It's putting a Band-Aid on it. You got to get to the root of the problem. We're meant to move.
Because it's such a large money-making industry, and people don't have the discipline a lot of the time to work out. And they make excuses, I don't know, about their time. They don't have enough time. But
yeah, it seems like it's the same thing as like the reason people don't go backpacking, just because people don't want to be uncomfortable. You're going to have to do that, obviously, for exercise and fitness. And yeah, people just don't want to do that. There's just a small majority of the population that will.
Yeah, it's a tough pill to swallow when you tell people like, yo, like all there is to it is you gotta like literally work hard. That's like the only ingredient you need. You just gotta work hard, and to do that's tough. I mean, it's a tough pill to swallow, but like if you just work hard, you're gonna be fine. Like discipline, boom.
How do you get that message across to some of your PT patients? How do they take it?
Yeah, so a lot of like, and when I was a personal trainer and stuff too, like a lot of them want like the latest science, and they want like the top of the line thing, so they don't have to work as hard. But really, you really don't have to get all that technical. People love to get technical, and it's just movement. Like so many low back pain patients, you know, like why does your back hurt? Maybe because you're sitting like literally all day. Maybe you're up an hour, and when you're sitting, you got that forward posture, you know, your spine's like this. I mean, you start moving the spine a bit, and they think I'm like some sort of god, you know, like, oh my gosh, my pain's relieving it. And they thought they had to get like back surgery. My dad even thought he had to get he was saying his kidneys were hurting. He's like, man, I gotta go see my doctor. My kidneys are going bad. It's like, wait a sec, Dad. I mean, it might be your back. And I literally he was better that day, just moving his back into extension, you know, because we are always limited in extension because we're flexed creatures.
Mm-hmm.
And it's, you just got to move it a bit, you know. You got to move in all directions. Full range is another thing. So I mean, people just aren't moving enough. That's usually what it is.
Well, it seems like people even in school talk about you have to sit up straight and whatnot, but it's more of just like you need to change positions every, you know, so often, just so it's like you're saying, getting all ranges of motion.
Yeah. And athletes are like a subset population. That's when you got to start getting technical. But that's like maybe 5%, you know, like most people aren't athletes. You know, they're just regular people with regular aches and pains that can be resolved like super easy.
Yeah.
But
seriously,
America
is the medicine, not only to cure things, but to prevent so many things. And like people, when they associate exercise a lot of the time, I think, with just getting shredded, being hot and sexy, and like it's just quality of life and happiness. That's what I think. When Ben and I recently joined a CrossFit gym, and I'm like more joining the CrossFit gym for my mental health than my physical, just because that community and just the endorphins and starting your morning right, like getting their blood pumping. You're like,
yeah,
I love it so much.
Yeah, it feels good.
Mm-hmm. You have that camaraderie, that tribal aspect, you know, with your CrossFit. I do like what CrossFit's about. It's almost like a church, but for exercise, because church has that community and they have those kind of like ritual things.
Mm-hmm.
But that's like literally CrossFit without like the religion. You know, they even have like the paleo diet, you know, the stereotypical paleos.
Mm-hmm.
They all like to do that. And I mean, it's good. I mean, I think people push it a little too hard, you know, especially like lifting fast. That's what I like about CrossFit. You're trying to lift things fast. I don't really like.
Yeah,
yeah,
when it turns into a sport, it's like, actually what I've realized, I used to like do a lot of, you introduced me to fitness, really. I mean, my dad kind of introduced me, but then you like taught me a whole bunch in high school. And I was doing a lot of like bodybuilding type of stuff. I wasn't getting much compound lifts because I would say my knees hurt, not knowing that like it would actually maybe fix my knees and my back to do compound squats, deadlifts, stuff like that. And then I would get hurt on the baseball field like it was my job. And now when I start doing more functional movements, if I start to push the speed, staying controlled, like let's say a kipping pull-up, it lets my muscles and my tendons and my ligaments feel that the tension and the stress and almost build to be able to withstand those things. So if I were to like trip and fall and try to catch myself weird, my tendons and ligaments would be like, I've done this before. So that's what I've felt.
Yeah, you're talking about like your Golgi tendon organs and your muscle spindles.
Yeah.
That's like proprioceptive feedback. Yeah. And like you can go as far as like I work at a nursing home right now, and literally like fitness there is walking and trying not to fall, you know. So how do you're talking about tripping and falling, those righting reflexes. That's what we call them, righting reflexes. And a lot of times older people, to improve those righting reflexes, dude, you just got to have like a strong tibialis anterior. So you should be able to dorsiflex real quick. Like you should have quick movements. I mean, you have like ankle strategies. We call them knee and then hip. It goes in that order. So when your body gets out of your base of support, the first thing that you'll activate is your ankles, then your knees, and then your hips, and then you drop your center of gravity. That's the next. It's like the chain of how it goes. So you know you got to strengthen those things to prevent falls. And I mean, like literally, the hardest part about my job is to motivate these people. You know, if they were motivated, they wouldn't be falling. You know, they would be exercising hard, but they don't really want to, and then they're falling, and it gets unsafe because they're just not exercising enough.
Yeah.
they're in their wheelchair all day, so their knees are flexed. So now they have contractures, so they can't fully extend their knees. So if you can't fully extend your knees when you're standing, now you can't rely on your bones to do their jobs. The bones aren't even lined up. You know, you're
not stacked.
140 degrees, so now you have to constantly use muscle.
Mm-hmm.
You know, now you're using muscle. Now you're getting tired. You can't stand that long.
Yeah.
You're getting tired. So then now they're going to sit even more, and it's a cycle. Then they're just going to keep sitting. Contractures get worse. So
Yeah,
break it.
When your bones aren't stacked, like it's a constant isometric hold to stand up.
Mm-hmm.
It's like a wall sit.
Yeah,
So
that's exactly right. And that's hard. I wouldn't want to stand either if I had to do that.
Yeah.
That ain't easy.
Yeah, I think you mentioned on the trip, like with a lot of those patients, you think of it in terms of like a 1 rep max. It's like standing up could be like a 1 rep max for them. Like imagine trying to squat 400 pounds 100 times a day or something.
Mm-hmm.
So
yeah, just throughout the day. And no way they're getting up 100 times. I'd be very happy if they got up 100 times a day.
Yeah.
They're getting up like 4 or 5 times a day because it's so hard. Because they don't want to squat 400 pounds, 100 times a day, because that would be exhausting. They only want to squat 400 pounds 4 or 5 times a day. And they're not warmed up either, So they have to do this 1 rep max not warmed up. That's uncomfortable. So how do you make that better? You got to make your sit to stand is what we call it, standing up. You can't make it a 1 rep max anymore. You got to be able to do that like 10 times. You got to make it the economy of movement has to improve. So then you're more likely to do it, because now you're not going to be, they're always like, oh my gosh, I want to stand up. And they're getting it in their head. Like, here we go. Here comes a 1 rep max. So it's important to keep up.
So what do you think is next for you in terms of like hiking trips with the boys, and B, just like fitness and just staying fit in general?
So like, I'm not big on powerlifting, and I like bodybuilding, because what bodybuilding is it's so low risk for injury. I don't want to get injured. That's like really the worst thing. I can't work if I'm injured, one, because, I got to hold people up all day, but then I can't exercise. I love exercising. I just like the pain of exercise. So bodybuilding is the perfect thing, because it's just like kind of time. I'm making sure I work all muscle groups, so I'll be more well balanced than maybe like a power lifter. CrossFitters are pretty well balanced. I mean, I could work my core more, but I want to definitely just continue with the bodybuilding and just pushing myself. Mm-hmm. I do want to run, because I am starting to get a little chubbier. My metabolism's starting to go down. But I'm at the age to where my testosterone's pretty much at the peak. Once you hit 28 is when it starts going downhill for men typically. But a lot of the big time weightlifters, they peak in their 30s, because it just takes so long to build muscle. I've been building muscle forever now. Yeah. But I just want to stay lean. I don't think I ever want to go over 190 pounds. I always want to keep, like a 6-pack just for me. Yeah. But, and then as far as hiking goes, we are still like evolving in that, because how we called this a sus trip, like a nice trip. We've never really had a nice trip go without a hitch, and it was kind of nice to like relax and hang out. So I think we want to do that once a year, 2 backpacking trips a year, really hard, and then a really easy. When I do the hard trips, that's when I run more. I didn't do any cardio for this one. I didn't train, but for the hard ones, I do usually train. I do a lot of cardio for them, and I lose some weight too.
That makes sense.
Just so I can be cardiovascularly fit. But this one I wasn't very fit for.